Next, to take the counterpoint will be Dr. Mike Marohn from Johns Hopkins, and he's going to argue that notes is in fact the next phase of MIS.
Could you put my slides up, please? Thanks for the opportunity, and I'm going to take a slightly different tack, if my slides will, there we go. I think notes is definitely going to be the usher in of the next phase of minimally invasive surgery. Notes per se, and I'll try to amplify this definition as I go through this, may not necessarily be where the area of explosion will be, but it gives us some unique opportunities to move forward. It's the next phase of MIS if we recognize its unique opportunity to shape the future of surgery and surgery collaborations, even reflected by this panel, which is both international and multidisciplinary in scope. And you've already seen some of the initiatives, collaborative initiatives that NOTES has fostered. That is really where we're going to be changing what we do in minimally invasive surgery, which is now already 20 years old. And I'm going to take a little bit of a hard line on some of the technologies that have developed and are merging in NOTES and try to make an argument of why we need NOTES to reinvigorate where laparoscopy and endoscopy have kind of gotten stuck. So I'm going to frame the problem, give some specific examples of enabling initiatives. So NOTES were at 4 years in terms of human experience. It's longer than that, obviously, back to the Apollo group from 1996. But NOTES represents the intersection of endoscopy, laparoscopy, and emerging technologies, and maybe not so much the last yet. But the technology challenges are really critical. We deal with them in laparoscopy today, we deal with them in endoscopy, but NOTES becomes a universe of the wizards only, in part because of the limitations of the technology. And we really do need future transdisciplinary collaborations. So at 4 years, NOTES begs comparison with the first 4 years of laparoscopy, which went from 0 to 400,000 laparoscopic cholecystectomies within 4 years. NOTES at 4 years remains investigational. It is not standard of care surgery. We've all agreed that it's investigational. By the most generous count, we're maybe at 250 human cases, which, by the way, all should be in a registry. There are limited applications, and we're struggling with what is the scope of NOTES. Is it pure NOTES? Is it hybrid? Is it single port access? So if we look at the evolution, this is kind of the stylized slide of the NOTES evolution that we're all supposed to be trying to get to the third corner of this slide. But if we really look at the spectrum of intervention and try to not to make it so all or none, if we look around at from open surgery to MIS, which had its hybrid form in hand-assisted laparoscopic surgery and a backdrop of robotics, which really faltered in general surgery, found its way in urology for prostatectomy. NOTES as it's emerging, we're struggling with is it hybrid NOTES? Is SPA or SILS, as discussed earlier, is that really pure NOTES? Is it okay to consider that? And then the parallel evolution of endoluminal, transluminal, and then the role of PillCam. And if we look at all of these really as a spectrum and in a blend, and opportunities to try to shape the best for our patients in terms of their future care, we may better take advantage of what NOTES has to offer us. If NOTES represents the intersection of endoscopy with laparoscopy, where are the respective technologies now? And a disclaimer that the next 3 slides are aimed at giving a perspective and admittedly greatly undervalue some of the remarkable technology breakthroughs that have in fact occurred in endoscopy and laparoscopy. But I'm going to take a little bit of a contrary view to make a point. If you look at the endoscopy revolution, last year was the 50th anniversary of Basil Hershowitz's dedicated efforts to develop the first endoscope. At the 207 50th anniversary of the flexible endoscope, we were unimpeded by significant progress. We're all still using the same endoscope, essentially, that Basil Hershowitz developed 50 years ago. What about our current technology? Let's see, it went the wrong way. In laparoscopy, which also marked an anniversary last year, the 20th anniversary of advanced laparoscopy. But what's our technology universe in laparoscopy and minimally invasive surgery? We are still using chopsticks, and we are still using a two-dimensional representation of a three-dimensional space. Not exactly wild progress in emerging technology. But what's more compelling and indicting is that take general surgery, where really the minimally invasive surgery exploded. 90% of advanced, really complex, cutting-edge cases are being done by less than 20% of surgeons. So what is our future? Is it a future of wizards or better enabling technologies, training, and educational implications? So what do we need? Well, we got a description this morning from Rich Rothstein and Bernard Dallemagne about the toolbox review for what we need in NOSCAR and notes. The initial white paper outlined a series of challenges that need to be resolved. The prior two international notes meetings specifically focused on these challenges. The July 2008 NOSCAR meeting will focus on the next phase of key enabling notes questions, and hopefully there will be an updated white paper from the 2005. But the future challenges, notes is not just about the size of the incision or having no scar. It represents the intersection of laparoscopy and endoscopy that have been mired in not great progress, still using chopsticks and 2D vision, still using the original endoscopic design, but yet now we're getting this tremendous fertile ground of these collaborative efforts because even wizards are limited in the notes environment. So we do need rocket science. High-tech computer-assisted solutions, are robotics the answer? Maybe not to the extent that that may be a cost-limiting factor. Santiago Horgan reviewed the evolving robotic options. I'll be interested to see what the next iteration of the material that he couldn't share with us looks like next year. But we do have modified tools and endoscopes for endoluminal, transluminal, and transabdominal intervention, which don't necessarily have to be restricted to a single narrow definition of, well, this is notes and that isn't. We need suturing devices, and we had a whole variety of them described earlier. The issue of triangulation, do we really need it? Ricardo Sorin and Tony Kalu would say perhaps maybe we can learn to work effectively coaxially. We just need to learn new skill sets. But I think everybody agrees that if we had the technology that was affordable and workable, triangulation is a traditional powerhouse of how we do complex surgery. The Endovia, Lee Swanstrom discussed some of the challenges with this as it's evolved and some of the other devices that need to, companion devices. What about stability and multitasking platforms? Those were described earlier by Chris Thompson. Some of the the transluminal as well as endoluminal closure and stapling devices. Again, there are a variety of them trying to make their headway into the scene. What about non-conventional instrument manipulation? Danny Scott shared with you some of the innovative techniques that they're using, and some of the other groups are starting to develop. Smart endoscope. Lee Swanstrom's group developed a little bit of a white paper in terms of what do we need for the future endoscope to really have it redefined. This is just one of the vendors' emerging devices, and there's now even a notes endoscope that Olympus has developed. Robotic endoscopy, again, computer-assisted endoscopy, capsule endoscopy. Paul Swain talked about his early experience with this. What if we move from the current capsule capability to one that can actually stop, find something on the fly, do real-time analysis, and page you to your workstation, where you sit at your workstation, you see the image, you deploy soldier pill cams to zap the lesion, that the pill cam capability with now a soldier pill cam is already out there. Well, in fact, there are some groups in Italy and the United States already working on exactly that series of capability. So as we even start to harness other capabilities that are available, remember the multitasking platform devices. They have endoluminal channels that will accommodate robotic devices that can be deployed in them so that we can then have complex capabilities, as Santiago was alluding to. So I think globally, Note's vision is that we have 21st century emerging technologies and intersecting disciplines. Read laparoscopy, endoscopy, and robotics, or emerging other technologies, where there's a fertile environment for interventional breakthroughs, which may be applicable not only to notes narrowly defined, but to endoluminal, transluminal, laparoscopic, or even open surgery. And I think that's probably where the greatest legacy of these notes initiatives probably is going to lie, where laparoscopy, interventional endoscopy, emerging areas of imaging, which we didn't even talk about, in computer-assisted capabilities, will start to merge in notes and the overlapping areas of that spectrum of care that I alluded to earlier. So that the smart endoscope, it's time for a new vision of GI imaging. Portfolios of projects, whether it's pill cam related, the scenario I gave before, a computer-based workstation, robotic capability, the snake example, the examples that Santiago talked about, image integration and enhancement, sensing capabilities, optical, molecular sensing that we didn't even talk about today, intelligent endoscopy with collaborative teams and resources and funding, so that we really do have the opportunity for notes to usher in a true revolution with bioinformatics in a digital age integrating informatics, imaging, and intervention, so that we're evolving from surgeons and gastroenterologists and interventional radiologists to interventionalists, using image integration with intervention, simulation augmented vision, virtual barriers for patient safety, and even single trocar interventional platforms, as we discussed. Remember the 50-year-old endoscope and the 20 years of laparoscopy, not so high tech. Notes pushes us to evolve. So is Notes the next step in MIS? Yes. But it is surgery with surgical requirements for complex dissection, tissue manipulation, and reconstruction, things that are extremely challenging if you try to live purely within the current definition of Notes. Feasibility, however, is established, but it's still not standard of care. We have the need for better technologies for numerous tasks, but you heard some exciting presentations today on where some of this stuff is going. Our toolbox is already being identified and defined and even developed, and the spectrum of emerging approaches is what will be the legacy out of the initial Notes initiative, whether it's hybrid, dual scope, single port access, spin-off, non-conventional manipulation with the magnets, robotic support, probably some of all of the above, with transdisciplinary and international collaborations. Thank you.